Hello and welcome to our deep dive into a significant and often controversial topic, the opioid crisis. In today's video, we're going to shed light on an issue that has left an indelible mark on our society, causing heartbreak for millions of families and leaving communities grappling with its devastating impacts. We'll journey together through the origins of this crisis, the role Big Pharma played in its escalation, the far-reaching economic and societal implications, and finally, explore the path forward. Our aim is not only to inform, but also to encourage critical thinking and conversation around this crucial issue. But before we begin, if you're new here, we invite you to join our community. We're dedicated to providing informative and thought-provoking content, breaking down complex topics, and offering insights on matters that affect us all. So hit the subscribe button and the notification bell to ensure you don't miss any of our upcoming videos. So, are you ready to unmask the opioid crisis and uncover the dark side of Big Pharma? Let's dive in. The opioid crisis, a modern tragedy of epic proportions, has laid bare many systemic issues within the healthcare industry, particularly with the pharmaceutical sector or Big Pharma. An examination of the opioid crisis provides an unsavory perspective of the healthcare business model, one where profits can sometimes overshadow principles. To understand the depths of this crisis and the role Big Pharma plays, we must delve into the opioid epidemic's roots, examining the ethical, economic, and societal implications. The roots of the opioid crisis trace back to the late 1990s, at a time when healthcare professionals were grappling with the challenge of managing chronic pain. A revolution in pain management was brewing, and it seemed that the pharmaceutical industry had found a silver bullet: opioid pain relievers. Companies like Big Pharma, Johnson & Johnson, and others manufactured and marketed these drugs as non-addictive, effectively luring the medical community into a false sense of security regarding the risks associated with these substances. Pharmaceutical giants armed with persuasive marketing strategies effectively propagated their narrative. They reassured the medical community that patients would not become addicted to prescription opioid pain relievers. As a result, these medications began to be prescribed more liberally. Primary care physicians, pain specialists, and other healthcare professionals were encouraged to consider opioids as first-line treatment for chronic pain, a move that catalyzed the normalization of opioids in medical practice. The flagship product that represented this movement was Purdue Pharma's OxyContin, introduced in 1995. The drug was aggressively marketed with claims that its long-acting formulation posed a lesser risk of abuse and addiction compared to other opioids, a claim that would later be deemed grossly inaccurate. Misled by such marketing narratives, many in the medical profession believed these drugs could be safely prescribed, even for moderate pain. However, as prescriptions for these drugs escalated, so did misuse. Before long, it became apparent that opioid pain relievers were highly addictive. The widespread misuse of prescription opioids soon spiraled into a full-blown public health crisis. Yet, by the time the medical community, regulators, and the public realized the extent of the problem, it was too late. The genie was out of the bottle. The mass overprescription of opioids had fostered a culture of dependency. Communities across the country, and later the world, would begin to feel the devastating effects of opioid addiction. The damage, as we now know, would not be limited to individual addicts. It would infiltrate families, ripple out to communities, strain healthcare and social systems, and cast a long, dark shadow over society at large. The disturbing truth behind the origins of the opioid crisis illuminates a grim paradox. An industry designed to foster health and save lives was, inadvertently or otherwise, doing the exact opposite. It was complicit in creating one of the deadliest drug epidemics in human history. The paradox is central to understanding the dark side of Big Pharma, marking the beginning of a deep dive into its role in the opioid crisis. The pharmaceutical industry's role in the opioid crisis is characterized by a troubling intersection of profit-driven motives and patient care, where the former appears to overshadow the latter. This pattern of behavior has been driven by multiple factors, including aggressive marketing tactics, unethical business practices, and a lack of sufficient regulatory oversight, creating a perfect storm that precipitated the crisis. Prominent within this narrative are companies like Purdue Pharma, Insys Therapeutics, and Johnson & Johnson, each with its unique yet similarly troubling part in the story. They represent a larger trend within Big Pharma, where strategic initiatives were seemingly focused more on profit margins than on the welfare of patients. Purdue Pharma, for instance, championed an aggressive marketing campaign for OxyContin, promoting the drug's supposed non-addictive properties to physicians and patients alike. These campaigns were often backed by incomplete or misleading scientific data, which downplayed the risks and emphasized the benefits. This contributed to the overprescription and subsequent misuse of OxyContin, which in turn played a significant role in fueling the opioid crisis. A striking example of extreme misconduct is Insys Therapeutics. The company allegedly created a scheme to bribe doctors into prescribing their powerful fentanyl-based drug, Subsys, a medication intended for cancer patients with severe pain. Insys used fraudulent marketing strategies, pushing the drug for off-label uses, ultimately leading to its overprescription and contributing to the opioid crisis. This deceit not only intensified the crisis, but also undermine the trust in pharmaceutical companies and healthcare providers. Johnson & Johnson, known more commonly as a family brand, found itself embroiled in the crisis. Although not as directly implicated in aggressive marketing as Purdue or Insys, the company supplied a significant portion of opiate materials to other manufacturers, thereby indirectly fueling the overproduction and overdistribution of these highly addictive drugs. These examples offer a glimpse into the questionable tactics used by some in the pharmaceutical industry. Fueled by profit-driven motives, these companies engaged in aggressive marketing campaigns and fraudulent activities that resulted in an oversupply of opioids. These tactics not only fueled the epidemic but also raised significant ethical and legal questions. The role of Big Pharma in the opioid crisis underscores a broader systemic issue. It brings into question whether the prevailing business model in the pharmaceutical industry, characterized by high-pressure sales and marketing, competition, and profit maximization, can coexist with the ethical obligation to protect patient health and safety. This conflict of interest, inherent in the current state of the industry, was a major contributor to the opioid crisis, providing a sobering insight into Big Pharma's darker side. The opioid crisis, while undoubtedly a public health disaster, has also wreaked significant economic havoc. The cost is not merely a direct consequence of the cost of the drugs themselves, but a cumulative effect of several factors: healthcare costs, the burden on the criminal justice system, lost productivity, and the cost of addiction treatment services. Healthcare costs have soared as a result of the crisis. The treatment of opioid abuse and overdose, chronic diseases resulting from opioid misuse, such as HIV and hepatitis C, and ancillary health conditions linked to opioid addiction, all contribute to the inflated healthcare costs. The healthcare system also bears the burden of neonatal care for infants born with opioid withdrawal symptoms due to maternal opioid use, termed neonatal abstinence syndrome, a condition that requires specialized and costly care. The criminal justice system has also been strained due to the opioid crisis. As opioid misuse often leads to an increase in drug-related crimes, the costs associated with law enforcement, court proceedings, legal representation, incarceration, and probation have dramatically risen. These factors have strained the resources of local, state, and federal law enforcement agencies and court systems, contributing to the overall economic burden. Lost productivity is another significant economic consequence of the opioid crisis. Individuals suffering from opioid addiction often face difficulties in maintaining regular employment due to physical and mental health issues, leading to reduced economic output. Additionally, premature deaths due to opioid overdose result in lost potential economic contribution. When aggregated at the national level, these losses in productivity contribute significantly to the overall economic cost of the opioid crisis. Furthermore, the cost of addiction treatment services also adds to the economic burden. These services encompass detoxification, medication-assisted treatment, counseling, and long-term recovery support. However, the demand for these services often outstrips supply, leading to longer waiting times and higher prices. Not to mention, there is also the cost associated with research and development for better, more effective treatments and interventions for opioid addiction. According to the Council of Economic Advisors, the economic cost of the opioid crisis in the United States was $504 billion in 2015, or 2.8% of GDP, underscoring the crisis's magnitude. The immense financial burden has far-reaching implications, affecting not just individuals and families but also communities and state and national economies. This financial burden can lead to a vicious cycle of poverty and addiction, exacerbating the crisis further and making it even more challenging to resolve. The economic implications of the opioid crisis are a stark reminder of how a public health issue can quickly escalate into an economic one, straining resources, hampering productivity, and hindering overall economic growth. As such, it underscores the urgent need for coordinated efforts to tackle the crisis not just from a healthcare standpoint, but from an economic one as well. The societal impact of the opioid crisis extends far beyond the individual victims of addiction, radiating outward to affect families, communities, and society at large. It has reshaped our social fabric, triggering a cascade of consequences that range from broken homes and increased crime rates to stretched healthcare systems and labor market disruptions. One of the most profound societal impacts of the opioid crisis is the destruction it wreaks on families. Addiction is not a solitary experience. It consumes not only the individual but also those around them. Parents, spouses, and children of individuals suffering from opioid addiction experience emotional trauma, economic instability, and the heartbreak of watching their loved ones succumb to the pernicious grip of addiction. Children, in particular, bear the brunt of the crisis. The rise in opioid addiction has led to a corresponding increase in child neglect and abuse cases, as addicted parents struggle to provide safe and nurturing environments for their children. The result has been a surge in the number of children entering the foster care system, placing additional pressure on already stretched resources. On a community level, the opioid crisis has led to increased crime rates, particularly drug-related offenses and crimes committed to support drug habits. This uptick in crime destabilizes neighborhoods, reduces overall community well-being, and strains law enforcement resources. The crisis has also had a profound impact on labor markets and economic productivity. Many individuals suffering from opioid addiction are of working age, and their inability to participate in the workforce due to their addiction exacerbates economic disparities and contributes to the cycle of poverty and drug abuse. Employers face challenges in finding and retaining workers in regions heavily impacted by the crisis, impeding economic development and growth. Healthcare systems, too, are stretched thin due to the opioid crisis. Emergency rooms are often the first point of contact for those who overdose, and the surge in opioid-related emergencies has strained resources and personnel. Medical professionals must also grapple with the emotional toll of treating repeated overdoses and witnessing firsthand the devastation of the crisis. Another striking societal impact is the rise in neonatal abstinence syndrome, a withdrawal syndrome experienced by infants exposed to opioids while in utero. This not only presents significant health challenges for the infants, but also results in long-term social and economic costs. The societal impact of the opioid crisis paints a sobering picture of a pervasive and destructive force that affects all corners of society. Its effects are multi-generational and deep-seated, leaving scars on individuals, families, and communities that may take decades to heal. In revealing the societal implications of the opioid crisis, we expose the insidious nature of this epidemic and the dire need for comprehensive interventions that address not only the individual but also the societal aspects of this crisis. Addressing the opioid crisis is a multifaceted challenge that requires a comprehensive, coordinated approach spanning various sectors, including healthcare, education, law enforcement, and policy making. The path forward, though complex, must be paved with strategies aimed at prevention, treatment, harm reduction, and system-level changes in the pharmaceutical industry. Prevention is the first line of defense against the opioid crisis. This involves comprehensive public education about the risks of opioid misuse, coupled with improved training for healthcare providers in responsible opioid prescribing. Additionally, prescription drug monitoring programs should be strengthened to detect and prevent doctor shopping and overprescribing. The development and implementation of effective, evidence-based treatment strategies are crucial. Access to medication-assisted treatment should be expanded. MAT combines medications that mitigate withdrawal symptoms and cravings with psychological and social support, providing a holistic approach to recovery. Moreover, reducing the stigma associated with substance use disorder is crucial to encourage more individuals to seek treatment. Harm reduction strategies are equally vital. This includes measures like naloxone distribution to prevent overdose deaths, syringe exchange programs to decrease the spread of infectious diseases, and safe consumption sites to provide supervised environments for drug use. However, these measures alone won't be enough unless there are substantial changes in the pharmaceutical industry and the regulatory landscape. Big Pharma needs to shift its business model away from an excessive profit-oriented approach to one that prioritizes patient safety and public health. Transparency in clinical trials, marketing, and pricing is imperative. The industry should also invest more in developing non-addictive pain management alternatives. On the regulatory front, government agencies need to exercise rigorous oversight over the pharmaceutical industry, particularly concerning the marketing and distribution of opioids. Policies should be aimed at holding Big Pharma accountable for unethical practices. Moreover, the creation of a well-funded, comprehensive national strategy to combat the opioid crisis is critical. Addressing the opioid crisis also involves tackling broader societal issues, such as poverty and lack of access to healthcare, which contribute to the crisis. Economic and social policies should be aimed at alleviating these underlying conditions. The path forward in addressing the opioid crisis is undeniably challenging and complex. It involves not just treating the symptoms of the crisis, but also addressing the root causes and changing the systems that allowed it to happen. Despite the enormity of the task, the cost of inaction is far greater. As such, it is a path we must tread with urgency, dedication, and a collective commitment to create a healthier, safer future. The opioid crisis unmasked the dark side of Big Pharma, exposing an industry where profit-driven motives seemingly overshadowed the health and well-being of patients. The cost of this crisis, measured in lives lost, families broken, and communities shattered, is a stark reminder of the profound consequences when ethical considerations are cast aside in pursuit of financial gain. This crisis underscored the systemic flaws within the pharmaceutical industry, highlighted the devastating economic and societal impacts, and illuminated the urgent need for comprehensive action. Solutions must span a range of interventions from improved prevention and treatment strategies to stringent regulatory oversight. and a fundamental shift in the business model of the pharmaceutical industry. Addressing the opioid crisis is a monumental challenge, requiring concerted efforts from all sectors of society. It's a call for change and accountability. The role of Big Pharma in the opioid crisis must serve as a sobering lesson, a catalyst for change in an industry where the stakes are human lives. The path forward must be marked by a renewed commitment to prioritize patient health over profit, uphold ethical business practices, and promote transparency and responsibility. While the crisis has shed light on the darkest corners of the pharmaceutical industry, it also presents an opportunity for the industry to redefine itself, to realign its motives with its mission of healing, and to rebuild the trust that has been so profoundly eroded. With these lessons in hand, society and the industry must work together to prevent the recurrence of such a crisis in the future and to ensure the primary objective remains the well-being of patients. Thank you for joining us on this exploration of the dark side of Big Pharma and the opioid crisis. We hope that this video has been both informative and thought-provoking, and it has underscored the importance of transparency, accountability, and ethical practices in all sectors, especially those directly linked to our health and well-being. If you found value in this content and want to learn more about such important issues, consider subscribing to our channel, hit the notification bell to stay updated on our latest videos, and share this content with others who might also find it helpful. Remember, your voice matters. By staying informed and spreading awareness, we can collectively contribute to a healthier and safer future. So, join us on this journey, and let's continue making a difference, one video at a time. Subscribe, like, and share, because together we can create a wave of change. See you in the next video.